Hello students, welcome to Angel Health Academy. Topic for the day is Code of Ethics. Code of Ethics for Nurses. So this topic can be used in different subjects like Foundation of Nursing. We have a subject of Code of Ethics by ICN and INC. And then 4th semester BSc Nursing we have Professionalism and Bioethics. In that also we have the topic of Code of Ethics according to International Council of Nurses and Indian Nursing Council. And the 4th year BSc Nursing students in legal practices of or ethical and legal practices of nursing, like that in nursing service management and education or administration, nursing administration subject. First is introduction. Ethics are the rules or principles that govern the right conduct of the nurse. That is the proper behavior of the nurse during the services which is rendered in the hospital settings or healthcare settings. So ethics are the set rules or principles. It is the principles that has to be followed during the services or during the care which is rendered to the patient by the nurses. So ethics in general are the rules or principles, set rules or principles that has to be followed by a particular group of people which govern, which control the conduct or behavior of a particular person. Then nursing ethics. That means nursing ethics are the rules and principles of in relation to nursing profession or nursing services. Thus, it refers to the moral code for nursing practice. So, it is the rules and regulations, or it is the principles, or it is the moral value or moral code for nursing practices or nursing profession. The next is code. Code is a systematic statement. So, it is the statement. It is a systematic statement of a body of law related to legislation or made by the statutory body or legislation. So, code is a systematic statement of a body of law. Thus, a code of ethics is a formal statement. It is a rules or principles, or it is a formal statement, that is systematic statement for the group's ideals and values in rendering services. So, code of ethics is a formal statement of the groups or the personnel or the professionals for the ideal practice or standard practices or quality services. So, in short, code of ethics are the rules and regulations or rules or principles or systematic statement or formal statement that allow the groups to practice ideally with moral values or with set standardized values to render the quality nursing services. Next is the definition of code of ethics. According to Potter and Perry textbook, they defined, the textbook is defined code of ethics as a code of ethics is a set of ethical principles. It consists of a group of ethical principles that are accepted by all the members of a profession. That has to be accepted by all the members of the nursing team or all the members of the profession, nursing profession. So, according to Potter and Perry, code of ethics is a set of ethical principles that are accepted by all the members of a profession, that is nursing profession. Then second definition is according to Lilly MS and Jaunita Lee. So, according to Lilly MS and Jaunita Lee, code of ethics is a guideline for performance and standards. So, it is a set guideline for the performance or practice of nursing profession, that is performance and standards, and it includes the personal responsibility of the nurses. Thus, the code of ethics will guide the person or the professional to perform well in the professional setting and to maintain or uphold the standards of that particular profession, and it promotes the personal responsibility and accountability in rendering the quality services. Next is the purposes of code of ethics for nurses. So, what are the different purposes, or what is the reason International Council of Nursing and Indian Nursing Council set code of ethics for the nurses? The first purpose is to set standards and general guidelines for nursing actions. So, nursing consists of number of nursing activities and actions. For that, we need guidelines and we need standards to render the quality services. For that, it has to be set by the International Council of Nurses and Indian Nursing Council. That is, first purpose is to set standards and general guidelines for the nursing actions or activities. Second purpose is to differentiate between right and wrong in nursing practices. What has to be done and what has not to be done in nursing practices. So code of ethics helps to distinguish between or differentiate between right and wrong nursing practices. Then third purpose is which enables, code of ethics for the nurses enables a correct decision in the nursing profession when it is required. So through this set principles or code of ethics, a nurse can take a wise decision or correct decision in the different situations or occasions. Then fourth purpose is it also helps to protect the right of all the individual patients. So code of ethics especially it's made to protect the right of every individual patients in the hospital setting or health setting. So these are the four purposes of code of ethics for nurses. Next is the types or forms of code of ethics for nurses. There are mainly two important forms or types of code of ethics for nurses. One is international code of ethics for the nurses, that is globally it is accepted or internationally it is applied, and second one is national code of ethics for the nurses, that is made by the particular national government. So code of ethics, there are two forms, international code of ethics and national code of ethics. So international code of ethics is developed by International Council of Nurses. ICN, International Council of Nurses, were developed international code of ethics for the nurses. Then national codes of ethics for nurses are developed by different nations. For example, American Nurses Association is having American code of ethics for nurses, and Canadian Nurses Association have Canadian code of ethics for nurses, and Indian Nursing Council have a Indian Nursing Council code of ethics. So there are mainly two forms or two types, international code of ethics and national code of ethics for nurses. In this video, I would like to talk about international code of ethics by ICN and national code of ethics for nurses by Indian Nursing Council. So first is International Council of Nursing Code of Ethics for Nurses. So as I already mentioned, it is developed by International Council of Nurses, that is ICN. So ICN Code of Ethics for Nurses. The first International Code of Ethics for Nurses was adopted or developed by International Council of Nurses in 1953. Then later it has been revised many times. It has been reaffirmed, modified at various times since. Most recently with this review and revision has completed in 2005. So they completed that revisions of the International Code of Ethics for Nurses, and most recently it is completed, its revision is completed in 2005. So let us talk about in detail about the ICN Code of Ethics for Nurses. The ICN Code of Ethics for Nurses has 5 principal elements. It has got 5 important elements, 5 principal elements that outline the standards of ethical conduct by the professionals or nurses. Standards of ethical conduct by the professionals. So we can have a small mnemonic to understand easily about the 5 principal elements of ICN Code of Ethics for Nurses. Otherwise also you can learn, but if you really require, you can follow this mnemonic. The mnemonic I have set for this ICN Code of Ethics for Nurses is nurses prepare and practice for PSC. You know that PSC examination. So nurses prepare and practice for PSC. So nurses prepare stands for nurses and profession. That is, you can remember that prepare, that stands for profession. So first one is, first principal element of ICN Code of Ethics for Nurses is nurses and the profession. Second, practice stands for nurses and practice. That is rendering nursing services, nursing practice. Nurses and practice. Then P stands for nurses and people. P stands for people. Then S stands for nurses and society. Nurses and society. And C stands for nurses and co-workers. That means International Council of Nurses Code of Ethics for Nurses is all 5 principal elements starts with nurses and like that. So nurses and profession, nurses and practice, nurses and people, nurses and society, nurses and core workers. So the mnemonic is nurses prepare and practice for PSC. So the Code of Ethics for Nurses according to International Council of Nurses has 5 principal elements or set standards. First standard is related to standard conduct with the or in the profession, nursing profession itself, that is nurse and profession. Second, in the nursing practice, that is nurse and practice in the clinical setting. And third one is nurses and people, that is with the individual patient. Then nurse and society, or people of the society, and nurse with the co-workers. So standard conduct of the nurses during a nursing profession or practices, that is nurses and co-workers. So let us discuss in detail about the principal elements of ICN Code of Ethics for Nurses. First Code of Ethics or element under ICN Code of Ethics for Nurses is nurses and the profession, nursing profession. The nurse assumes the major role in determining and implementing acceptable standards of clinical nursing practice, management, research and education. So according to this element or this code of ethics, the nurses, all the nurses assume that the major role of the nurse is to determine, to find out and implement the acceptable standards of nursing services in the clinical settings, in the hospital settings or health center settings. Then in the nursing management, ward management, during ward management or nursing management, during nursing research and during nursing education. So according to this, the standards, ethical standard under nurses and the profession, nursing profession, all the nurses should assume or must assume that their major role is, first is determining or find outing and implementing various set standards of nursing care, nursing services in the clinical settings, and set standards they have to follow, quality standards during the ward management, during nursing research and nursing education. The second point is the nurses is active in developing a core of research-based professional knowledge. Of course, always nurses should update her knowledge and she should be always active in developing the current knowledge, that is current professional knowledge based on the current research studies, that is indirectly we call evidence-based practice. She always has to follow or practice the evidence-based practice, that is latest evidence-based practices in her professional practices. So the nurse should be active or must be active in developing a core of research services or research-based professional knowledge or evidence-based practice in her nursing practice. The third point is the nurse acting through various professional organizations. For example, Trained Nurses Association of India is a professional organization in India. So the nurses acting through the professional organization must participate, always participate in creating and maintaining safe, equitable and economic working condition in the nursing setting or nursing professions. So always nurse acting through any professional organization, they have to participate in various seminars, workshops, sessions for creating and maintaining the safe environment for their working situation and equitable, equal services, equally providing services, equitable and economic, less expenditure from the side of the part of the patient, and economic working condition in nursing practice. So these 3 points comes under nurses and the profession under ICN Code of Ethics for Nurses. First, nurse should assume the or understand the or finding out and implementing the acceptable standards, set standards of nursing practice, that is quality nursing services, not only in the clinical setting but also in the ward management and in the research, nursing research and nursing education. Then she should be actively develop the current updating evidence-based practice and knowledge that has to be implemented during her nursing practices. Third one is nurses should act through the professional organization and participate in various sessions in creating and maintaining the safe, equitable and economic working condition, safe working condition for the nurses. The second element, principal element of INC Code of Ethics for Nurses is nurse and practice. That is also same related to profession only. She practice in the different clinical setting. What all the things she has to do, nurse and practices. The nurse carries personal responsibility and accountability for nursing practice and for maintaining competency by continual learning. So of course, a nurse has to improve or develop or promote her education through continuous learning or continual learning, and she should have maximum competency, knowledge and skill to render the quality-based services. Thus, she will be accountable and responsible for the services which she rendered in the clinical setting or hospital settings or in the health center settings. So, the nurse carries personal responsibility. She should personally responsible to render the services, and she should be accountable to the outcome of that particular services, that is all the nursing practices. And for that, she should maintain the competency, update knowledge and skill by continuing education and continuous learning. Then second point is, the nurse maintain higher standards of nursing care possible within the reality of the specific situations. So, in that particular situation of rendering various nursing services, within that reality, within that limit of the situation, she has to render or maintain maximum higher standard of the nursing services or nursing care, that is quality and comprehensive nursing care, if there is a possibility in different reality of our particular situation. The third point is, the nurse should maintain a standards of personal health. Herself, she should maintain a quality health or personal health such that she should be able to provide care is not compromised. She shouldn't compromise with her services based on her health condition. She has to maintain a standard of personal health, her own health, positive and optimum health. Thus, she can render the quality services or standardized competency services or comprehensive services to the patient without any compromising her services, without any scope of compromising the services because of her personal health. So, she should maintain a standard personal health. The third principal element according to ICN Code of Ethics for Nurses is nurse and people. Nurses and the people. The public. Nurses and the people or nurses and the public. The nurse's primary professional responsibility is the people. So, ultimate aim or most important prime professional responsibility of a nurse is related to the individual patient, that is to the people who require nursing care, who get admitted themselves into the particular hospital as a patients. So, the nurse prime professional responsibility is to the people or to the patient who require care. Then the nurses should provide care, promote an environment in which the values, customs and spiritual beliefs of the individual has to be respected. So, whenever the nurse provide nursing care to the patient, of course, she should think about to promote the environment, that is a healthy and conducive environment for the patient. And of course, she has to give respect to the values of the patients, different customs of the patients, and spiritual beliefs of the patients, and healthy practices is like everything has to be respected and has to be understood by the nurses in providing the nursing care to the patient. So, patient may come from different situations with the different values, different customs, different beliefs, practices, etc. So, the nurse should be keen, aware about and respect about their individual values, likes, customs and spiritual beliefs. That has to be respected. The nurse should hold the confidence personal information and use judgment in sharing their information. So, whenever the nurse communicate the particular information about the patient, she should be very confidentially, it has to be transferred when it is required to improve his health status only. Otherwise, she should hold the confidence of the personal information without sharing to other people, and use judgment whenever she has to share this information to other health team members or other persons. These all the points comes under nurses and people under 5 elements of INC Code of Ethics for Nurses. The fourth principal element of Code of Ethics for Nurses by ICN, International Council of Nurses, is nurses and society, the professional conduct or set standard conduct of the nurses with the society. The first point is, whenever the nurses get opportunity, they have to participate and they have to share their responsibility with the other citizens or other healthcare professionals, other peoples and etc. Then make the people to do self-care themselves to render the services to their family members. So, the nurses of course has to participate and share the responsibility with the other citizens and of course with the other healthcare professionals. So, their knowledge, their skills, their responsibility has to be delegated, has to be shared, has to be transferred with the other citizens and other health professionals, thus to promote a healthy society. Then second point is, recognize and perform the duties of citizenship. So the nurse of course understand the rights and rights of the individual, rights of the people, and they have to recognize the different activities and different functions of the people and perform the duties for citizenship. So as a person in the society, she has to promote the society, positive health of the society people. Thus, she has to recognize and she has to perform the various duties of the citizenship in the society to improve the health of the people in the society. The last point is aware of the different or various laws and regulations, public health laws, which affect the practice of medicine and nursing in that particular society. So first the nurse should have aware about the different public health laws and regulations. Then she has to which affect the practice of her medicines and her nursing professions. Thus she can promote the health of the society. So these are the 3 points comes under nurses and society under the 5 elements of Code of Ethics for Nurses by ICN. The last or fifth principal elements of Code of Ethics for Nurses by ICN is nurses and co-workers. Of course, she has to work in a healthcare team. So, nurses and co-workers. The nurse sustains or maintains a cooperative relationship with all the co-workers in nursing and other fields, paramedical professionals, because it is a teamwork. So, rendering or promoting the health of the people is not by a single person, it is the effort of a team. So, thus nurses should sustain or maintain a good cooperative relationship. Of course, they should have a cooperative relationship with her co-worker and other paramedical staffs and paramedical departments, other hospital departments or other fields. The second point is the nurse should take appropriate action to safeguard the individuals, families and communities when their health is endangered by any co-worker or any other person. So in such situations, when the patient health is endangered or got a danger by the activities of any co-worker or any other health personnel, then she should take appropriate actions or safe actions to safeguard the health of the individual, families and communities in the hospital settings and in the community settings. So these are the professional standard conduct of the nurses under fifth principles of Code of Ethics for Nurses ICN, that is nurses and co-workers. So these are the 5 important principal elements of Code of Ethics for Nurses under ICN, International Council of Nurses. Next is the National Code of Nursing Ethics. So Code of Ethics for Nurses in the national level. So there are many Code of Ethics, National Code of Ethics. Here I have some example of American Nurses Association Code of Ethics for Nurses, Canadian Nurses Association Code of Ethics for Nurses, and INC, Indian Nursing Council Code of Ethics for Nurses in India. So different nations having their own Code of Ethics for the nurses to render the quality services and maintain the standard and dignity in the nursing professions. In this video I would like to talk about Indian Nursing Council Code of Ethics for Nurses in India. So let us talk about INC Code of Ethics for Nurses in India. I have made 2 mnemonic to understand the INC Code of Ethics for Nurses in India. INC Code of Ethics for Nurses in India, there are 7 Code of Ethics, but in International Council of Nurses we have only 5 Code of Ethics. So this 7 Code of Ethics, somehow it is a little bit tough, but you can remember with the following this first or second mnemonic. So first you practice with the first mnemonic, it will be somehow easy. Then after you follow all those things, when you understand the content, you can apply the second mnemonic, that is directly related to INC Code of Ethics for Nurses in India. So the mnemonic is use practiced CPR when required. So of course we practice the CPR. So use that practiced CPR when it is required. This is my mnemonic for the INC Code of Ethics, 7 Code of Ethics. So use stands for uniqueness of the individual. So all the individual are unique, they vary. So when rendering the services, it has to be seen by the nurse, the uniqueness of the individual. So use uniqueness. Second one is practiced. Practice within the framework of that particular profession. Of course, nurse has to practice within the framework of the that boundary of that particular profession. Okay. See, competency. Competency is nothing but knowledge and skill. Update knowledge and skill, that is competency, that is needed to render the quality nursing services. Then P stands for privacy, maintaining the privacy, that is the right of the patient, and confidentiality in sharing the information, taking consent for any activities. So privacy and confidentiality. R stands for rights of individuals. So we will study in the next video, that is what are the different rights of bills of patient bills. So patient has got a different rights according to Ministry of Health and Family Welfare. There are 17 rights. Okay, that is called rights or bills of patient right. Then when stands for work harmoniously with the health teams. So work harmoniously, we already discussed, that is cooperatively work with or collaboratively work with the different departments, co-workers, etc. So work harmoniously with the health team members. Then required stands for reciprocate the trust. Reciprocate the trust means reciprocal trust. So societies already have a trust towards the nursing profession and nurses. They render the quality services to the public. Thus they promote the public health. So that trust has to be maintained. That trust has to be continued. So nurses should always vigilant with to maintain that trust with the society people. So required stands for reciprocate the trust that is already have by the people of the society towards the nursing profession. So these are the 7 INC code of ethics. That is, first is uniqueness, second one is practice within the framework of the profession, then competency, then P stands for privacy and confidentiality, R stands for rights for individual, then stands for work harmoniously with the healthcare team members, then required stands for reciprocate the trust. So first you learn this mnemonic, that is use practiced CPR when required. So let us explain the 7 INC code of ethics with this mnemonic first. Later I will apply the second one. The second one will be little bit tougher, but that is as similar as the INC code of ethics. Thus the second mnemonic is the nurse respect the uniqueness, rights, privacy of patient and maintain competency in practice, work and relationship. All this code of ethics of INC, three code of ethics is spelled like same sentence like the nurse respect. That means the nurse respect the uniqueness, the nurse respect the rights of the patient, the nurse respect the privacy of the patient and confidentiality. Like that it will come. Then next, the fourth one will come, the maintaining the competency in the nursing profession, and that will be continued with the practice of nursing profession, the harmonious work with the health team member, that is work, then relationship, that is reciprocal relationship. The mnemonic is the nurse respect the uniqueness, rights, privacy of patient and maintain competency in practice, work and relationship. So the same only the meaning, but I have made a different 2 mnemonics. You can apply the first mnemonic, second mnemonic we can apply at the last after explaining everything, then it will be easy to apply this mnemonic. So as per the first mnemonic, INC code of ethics for nurses in India, there are 7 code of ethics. First one is uniqueness of the individual, second one is practice within the framework, third one is competency, fourth one is privacy and confidentiality, fifth one is right of individuals, and sixth one is work harmoniously with health team members, and last one is 7th one is reciprocate the trust. So there are 7 INC code of ethics for nurses, and international ICN code of ethics we have only 5, but here INC code of ethics, national code of ethics we have 7. This is simply the meaning to understand the particular INC code of ethics. With this you can understand, you can learn, you can by heart, and you can apply the knowledge of writing the answer of the question of INC code of ethics for nurses in India. So there are 7 INC code of ethics for nurses in India. Let us discuss one by one. So the first one is the nurse respect the uniqueness of individual in provision of care. So whenever the nurse rendering nursing care to any patient, she should respect the uniqueness, individuality of that particular patient, because uniqueness and individuality is vary from patient to patient. That is likes, dislikes, the religious practice, traditions, culture, beliefs, etc. So of course nurse should respect the uniqueness of each individual in provision of rendering various nursing care. This is the first code of ethics under Indian Nursing Council. So there are 5 sub-points under the nurses respect to the uniqueness of individual in provision of care. That is, for easy understanding, I have been divided into 5 areas with 5 small sentences. So with that you can write the 5 subpoints of the first code of ethics of Indian Nursing Council. So first subpoint is care without discriminations. Care without discriminations. So nurses should render all the nursing care to the patient without any discrimination based on their age, sex, religious, occupational status, educational status, socio-economic status, other background, etc. So care without discrimination is the first point. Second point is individualizes the care. So based on the individuality and uniqueness, we have to provide the render the nursing care. That is individualizes the care. Third one is appreciate and facilitate the participation of the patient in his healthcare services. So appreciate and facilitate the participation of all the individual patient in their treatment. Then fourth one is have a trustful relationship with the patient to render the services. So we need the cooperation of the patient to complete the nursing care services. So make a trustful relationship with the patient or individual. Then the fifth point is subpoint is uniqueness of response. So find out the response of the particular individual patient towards the healthcare services or practices. That also vary from patient to patient. That's what it is called, uniqueness of the response of the patient in having or undergoing certain health services or care that is provided by the nurse. So these are the 5 subpoints comes under the first code of ethics by Indian Nursing Council. So let us see the subpoints of the first INC code of ethics for nurses in India. That is, the nurses respect the uniqueness of individual in provision of care. So first subpoint I have said care without discrimination. That means provides care for individuals without considering the caste, the creed, religion, culture, ethnicity, gender, that is male and female, socio-economic status and political status, personal attributes or personal etiquette of a particular patient or any other grounds. So without here equitably has to be distributed the services without any discrimination, without considering the point of the caste of the patient, the creed of the patient, religious background of the patient, cultural practice, his ethnicity, white or black, gender male or female, upper socioeconomic, lower socioeconomic or socioeconomic background, political influence of different political ruling party or personal characteristics, etc. So that is the first point. Provide care for individual without considering anything, that is without any discrimination. The second point is, subpoint is individualizes the care. So as we said, the patients are unique or uniqueness. So patient care will be vary, that is individualizes according to his need, according to his likes. So individualizes the care, considering the care that is for a particular patient, considering his beliefs, his values and cultural practices or sensitivities. Based on that we have to individualize the nursing care. Third subpoint is appreciate the place of individual in family and community and facilitate their participation of significant others in the care. So appreciate the role of the particular individual in his family. So in his community, okay, appreciate what they are doing, okay, for the promotion of health. Of course, at the same time, facilitate their participation, motivate them to participate in their services or the significance of other people in their family in aspects of health care. Then fourth point is develop and promote the trustful relationship with the individual patients. So then only we can complete the nursing care and patient also will cooperate or participate. Then fifth point is recognize the uniqueness of their response, patient response or individual's response towards the interventions, towards the implementation of nursing services and adapt accordingly, then make changes and modify their participation and uplift their participation in their self-care practices and care of their that family members. So recognize the or differentiate the, identify the uniqueness of the response of different individuals. So these are the 5 sub-points which comes under the nurse respect the uniqueness of individual in provision of care. This is the first code of ethics under Indian Nursing Council. The second code of ethics under INC is the nurse is obliged to practice within the framework of ethical, professional and legal boundaries. Of course, the government set certain rules and regulations for the practice of the professionals in that particular state. Okay. Or Indian government has a particular that framework for ethical, professional and legal boundaries for the nurses, like that is given by the INC. So all the nurses has to be obliged. They must practice within the framework what they have given the right rules and regulation, based on the rules and regulation that is related to ethical considerations, and profession says that what to do, what should not do, okay, what not to do, and the legal boundaries that is set by the accreditable body like Indian nursing councils or state nursing councils, etc. So this is a second, nurse is obliged to practice within the framework of ethical, professional and legal boundaries. Ethical is now following the national code of ethics. So in that, first point is sub point of the second one is code of ethics and code of professional conduct. So Indian nursing council set by the code of ethics and code of professional conduct, behavior of the nurses, that must be followed. Second one is the nurse has to familiarize the different relevant laws and practices of that particular state. So she has to get licensed, registered in the particular state to practice or render the services, and she has to understand what are the rules, laws and regulations or legislation for her practice in the particular state that has to be followed. So familiarize means understand and do according to that. So these are the two sub points comes under the second code of ethics by INC, that is nurse is obliged to practice within the framework of ethical, professional and legal boundaries. So the first sub point is adhere to the code of ethics. So the code of ethics has to be understand in the particular state or particular country, and that has to be understand and that has to follow, that is adhere to the code of ethics and code of professional conduct for the nurses in India, developed by Indian Nursing Council. So Indian Nursing Council developed a code of ethics, code of professional conduct that has to be that has to be adjusted, that has to be followed in her practice. Second, familiarizes with the relevant laws and practices in accordance with the law of the state. Particular state, the government of India has given freedom for the state to follow develop certain set laws and practices in that particular government. That should be understood by the nurses, those who are working in the particular state, and they have to follow according to that law. That is relevant laws and practices. So these are the two sub points comes under. The nurse is obliged to practice within the framework of ethical, professional and legal boundaries. Now the third code of ethics under Indian Nursing Council is nurse maintains competency in order to render quality nursing care. Of course, nurses has to render quality nursing care and comprehensive nursing care. For that, she has to maintain a competency, that is update knowledge and skill in rendering the services. So the sub points I have been made here is, first point is nursing care by registered nurses. So all the nursing care, quality nursing care has to be rendered only by the registered nurse. That is the first point. Second point is whatever services has to been given to the patient, that has to be quality nursing care and comprehensive nursing care. So quality nursing care. Whenever an opportunity comes, the nurse has to render quality nursing care. Third point is continuing education. She has to update her knowledge, update her skill. For that, she has to continue her education, update her education. Then participation in various nursing research to improve the knowledge and application of the evidence-based practice in the current situations. So these are the four sub points comes under nurses should maintain the competency in order to render the quality nursing care. So the third code of ethics by INC is nurse maintain competency in order to render quality nursing care. The first sub point is nursing care must be provided only by the registered nurse, not by the other assisted nurses. The nurse strives to maintain, always she has to struggle and strives and vigilance to maintain quality nursing care and uphold the standards of nursing profession and nursing service. So nurse should strives to maintain quality nursing care and uphold the dignity of the nursing profession and standard of the nursing care whenever she get an opportunity. The third sub point is nurse values continuing education. She has to give importance to the continuing education updating her knowledge, her education, initiate and utilizes all the opportunities for her self-development in rendering the competency services. So whenever she has an opportunity, she has to go for higher education, continuing education. Thus, she has to have self-development in rendering quality services. Then fourth point is, nurses should value the research. She has to give importance to the nursing research. Always she has to participate in nursing research as a means of development of nursing professions. Through research only nursing profession will develop. And of course she should participate in all the nursing research adhering to the ethical, based on the adhering to ethical principles, or based on ethical principles she has to participate to various nursing research. Thus she has to maintain competency in rendering quality nursing care to the patient. Then the fourth code of ethics under INC, that is, the nurse respect individual's right to privacy of the patient. Then maintains confidentiality in sharing the information, or judiciously she has to share the information whenever it is required. Only whenever it is required. So the nurse respect the individual's right, patient's right to privacy. This is only, we have many patient rights, patient bills of right, in that right to privacy and confidentiality in maintaining the personal information, and shares information judicially whenever it is necessary. So the three sub points I have made. One is individual's right to privacy. Of course, nurse should consider the individual's right to privacy whenever it is required. Then maintaining the confidentiality. Second point is confidentiality. Third point is discretion and judgment. This comes under the second point only, but for your understanding I made it is a third point, that is judgment. This is a judicial information judiciously she has to transfer. That comes under discretion and judgment. So the sub points are, first sub point is respect the individual's right to privacy of their personal information. So all the personal information of the individual patient has to be kept confidentially. So that has to be, that means respect the individual's right to privacy. Every individual has the right to privacy of their personal information. That should not be shared without their consent or without their permission. Then second point, sub point is maintains confidentiality of privileged information except in the life-threatening situation. Otherwise, all the personal information of the patient has to be, or privileged information has to be maintained confidentially. That should not be shared. Okay. So maintains confidentiality of all privileged information of the patient except in the life-threatening situation. In such a situation, it can be shared, but provided in such a situation, it has to be use discretion and judgment in sharing the information, whether it is required, whether it is not required, whether this information will help the patients or it may spoil, indirectly affect the patient. So use discretion or judgment in sharing the information. So these are the two sub points for nurse respect individual's right to privacy, maintains confidentiality and shares information judicially. The fifth code of ethics, INC code of ethics, is the nurse respect the rights of individuals as a partner in care and help in making informed choice. All the care will be done by consent, taking consent, that is informed written consent from the patient. So all patient will be given informed choices. From his choice only we render the services, because as the patient is the partner in our nursing care. So right of individuals has to be maintained. So the nurse should respect the rights of each individual, rights of all patients as partner in care, and helps in making informed choices and take the informed written consent from the patient to render the services. I have made four sub points. First one is appreciates individual right. So we have to respect and appreciate all the patient as an individual with the individual right. Second sub point is respect the decision which is taken by the patient in relation to his healthcare services. So patient should be involved in his healthcare services. Then protect the public, promote the health and protect the public, protect the people of the society. Then fourth one is special protection has to be given to the vulnerable group in the society or vulnerable people in the society. So special protection or attention to the vulnerable people, those who are prone to have more problems, those who are risk in having many problems. So that is vulnerable people. So the first subpoint is appreciate the individual's right of all the patients to make decisions about their care, and therefore gives adequate and accurate information to the patients, individual patients, for enabling them, helping them to make the informed choices or informed consent. So appreciate the individual right to make decisions, because every individual can make decision in relation to his health services. So that should be appreciated. Then patient should be given an opportunity to take individual decisions, and therefore gives adequate and accurate information in relation to the health services and health care of the patient. That will enable the patient, or that indirectly help the patient to make informed choices. He can make some particular choices. All those information has been already given to the patient. With his consent only, with his decision only, will continue the services. Second point is respect the decision made by the individual regarding their care. So the individual patient can take his decision in relation to his health care services, healthcare activities. That has to be respected. That has to be given, appreciated and respected. So respect the decision which is already taken by the individual patient regarding his care. Then third point is protect the public from misinformation and misinterpretation in relation to health matters. So the misinformations regarding any topic, misinterpretation regarding the health services or health care should not be given to the patient, so, or the public. So public has to be protected, or people has to be protected from misinformations, wrong information and misinterpretation in relation to the health services, health matters, etc. Then fourth point is advocate special provisions. So give special attention or special provisions wherever necessary, whenever necessary, to protect the vulnerable individuals or vulnerable groups in the society. Those are prone to have more diseases like aged people, children, etc. and antenatal, internatal, postnatal period, all considered as a somehow they need a special attention and special provision. So advocate, inform and use maximum special provisions, apply that special provisions, utilize the special provisions to protect the vulnerable individuals or groups in the society. So these are the 4 points comes under, as a sub points comes under, the nurse respects the right of individual as partner in care and helps in making informed choices. The sixth code of ethics of INC is nurse is obliged to work harmoniously with the members of the health team. So she has to work always harmoniously, cooperatively, collaboratively with the team members, healthcare team members or nursing team members. So 2 sub points comes under this is appreciate the team effort. So a single person alone cannot render the all the services, comprehensive services which is required by the patient. So it is a team effort. So appreciate the efforts which is taken by all the team members. Second, cooperate, coordinate and collaborate with the team whenever it is necessary, wherever it is necessary to render the quality nursing care. So the first sub point is appreciate the team efforts in rendering patient care or individual care. So nurse is obliged to work harmoniously with the members of the health team. In that first sub point is appreciate the effort which is taken by the different team members in rendering patient care or nursing care. Second point is cooperate, coordinate and collaborate with various health team members, health team departments, etc. So cooperate, coordinates, collaborates with the members of health team to meet the needs of the people, to meet the demands of the people, to complete the quality nursing or render the comprehensive nursing care to the people. So these are the 2 sub points comes under 6th code of ethics by INC. The last code of ethics, that is 7th code of ethics by INC, is nurse commits to reciprocate the trust invested in nursing profession by society. Society always, of course, it is invested some trust towards the nursing profession. That means they believe that nurses render the quality services to the public. That has to be understood by the nurses, and they have to commit to reciprocate, continue the trust invested by the public in the nursing profession or by the society towards the nursing profession. 2 sub points are personal etiquettes and professional attributes or professional etiquettes. Etiquette is nothing but certain set of standards to say what to do, what should not to do, what to do, what not to do. Okay, so let us discuss the sub points of 7th code of ethics. So the first sub point is demonstrate personal etiquette in all dealings. So whenever a nurse get an opportunity to do the services or under the nursing care or participate in healthcare teams, she has to demonstrate, shows personal etiquettes. So demonstrate always shows the personal etiquettes in all dealings with the health team members, with the patients, with the community people, with the families, etc. Second point is demonstrate professional attributes in all dealings. So professional behavioral and personal behavioral both must be as per the etiquette. So demonstrate personal etiquette and demonstrate professional attributes in all dealings with the professional organization and healthcare team members. So these are the 7 INC Code of Ethics for nurses in India. After understanding all those things, we can or you can apply the second mnemonic that says the nurse respect the uniqueness, rights, privacy of patient and maintain competency in practice, work and relationship. After understanding all the subjects, you can write in this format. The first INC Code of Ethics for nurses in India is the nurse respect the uniqueness of individual in provision of care. Second, the nurse respect the rights of individual as partner in care and helps in making informed choices. The nurse respect the individual's right to privacy, maintains confidentiality and shares information judicially. That is the third one. Then fourth one is the nurse maintains competency in order to render quality nursing care. The fifth Code of Ethics is the nurse is obliged to practice within the framework of ethical, professional and legal boundaries. The sixth one is nurse work harmoniously with health team members. And seventh one is the nurse commits reciprocal trust with the society. So far we have discussed about the Code of Ethics of International Council of Nurses and the Code of Ethics given by the Indian Nursing Council. So there are 5 Code of Ethics by International Council of Nurses and 7 Code of Ethics by Indian Nursing Council. So thanks for watching. Hope this video really benefits in your studies and exams. And if you feel it is really worth, like, share and subscribe my channel. And stay tuned with the Angel Health Academy for the next an important academic and education video. Thank you.